Hey guys, I hope you all had a good Thanksgiving. I just wanted to share some news that I've learned over the past couple days. Sunday I woke up with some pretty excruciating cramps in my stomach. Kind of felt like a vice grip was around my stomach. I thought, oh, maybe I'm just bloated or constipated or something. I'm just gonna kind of rally through the day so I can come visit this beautiful place that I'm sitting at right now, which is my best friend Allie's new beach house. Congratulations, Allie. So we came down here and I was just trying to put on a strong face and power through, but I told myself if I didn't feel better Monday morning that I would go to the doctor. So lo and behold, woke up Monday morning and still felt like shit. So called the doctor. I wasn't able to get in until 3:30 in the afternoon, so just kind of powered through and got to the doctor, and she agreed that my belly felt a bit protruded and that, you know, she was a bit concerned. So she ordered a CT scan for Tuesday morning, recommended trying to get it that night, but we went to an imaging center and went to a hospital, and short of an ER visit, I couldn't get in, and so we decided to stay the course until Tuesday morning. So I got the CT scan, which is kind of weird. It makes you feel like you're going to pee your pants, but it, centers and provides a better view for them based on the contrast of the area of concern, in this case my bladder. And so they were like, yeah, you'll have the results in 3 to 5 days. And I was like, well, I think it says stat on the order. Really need these today. So those came over in a few hours, and I started, kind of playing Dr. Google with what I read in the results, but eventually heard from my doctor about 5:30, and she said, yeah, I don't like the looks of these. There's the presence of ascites, which is some fluid around my uterus, and there's about a grapefruit-sized mass there, Melinda. So that was not great news, obviously. So she said, let me talk to my husband, who's a radiologist, and call the office and see if we can get you in for an MRI and a pelvic ultrasound tomorrow, if possible. But given that it's the day before Thanksgiving, that's probably not going to happen. Call me back the next morning, and she said, you know what, you just need to go to the ER. You're going to get all these tests done a lot faster, and this isn't something that I think we should wait on. So Dave and I went and commenced the ER Olympics yesterday. I think I saw about 3 or 4 doctors, tons of nurses, poked, prodded, everywhere and anywhere. At about 3:30, an oncologist came out, introduced himself in an oddly public area, lots of people around, and said, I'm very concerned with the results of these, and there are 3 things that are causing me concern. And one is the presence of the fluid around the ovaries, one is the size of the mass, and then another is a blood indicator, which I think is called an AC-125 or something. I think it's present in a hormone test, so get your hormones tested. I never did because I couldn't get hormone replacement therapy because of my breast cancer, but this would have shown up, I guess normal range is like a 30 and mine's a 1400. So he said we've got to operate on this very soon, and there's a small chance it's benign, but it's looking like it's probably cancer. So we'll know more next Wednesday. You guys will probably know before I do, because I'll be under for about anywhere from 2 to 8 hours while they pull the mass, or let's call it what it is, a tumor out. And they will know within about 20 minutes about, whether it's cancerous or not, and they'll look for the presence of, cancer maybe in the liver, the bowels, elsewhere, and deal with that while they're in there. The good news, let's talk about the good news, is it looks like the rest of my organs are good. It doesn't look like it's spread into lymph nodes or anything based on what they can see so far. So more to come. in terms of how I'm feeling, I'm terrified. This one's hitting a lot different than my breast cancer diagnosis just because I had months to process that and we got it so early. And frankly, I think this has been going on for a while. So the pain that I felt on Sunday, I actually feel pretty normal right now, which is weird, is called oh, I can't even think of the word right now. Basically, it twisted, the mass twisted around the ovary, and that's what caused the acute pain. A torsion, that's what it's called, a torsion. I think I had one last year in Spain. I had these same sort of symptoms, and I just thought, again, oh, I'm just eating, a lot of rich food and drinking a lot of kava and whatnot, and if I don't feel better when we go home, I'll deal with it then. So I just sort of kicked the can, but I had gained a lot of weight when we were in Europe, and I had a big fat belly, and I was like, oh, I guess this is just menopause. So I guess, the message there is listen to your body. I'm so glad I did, because had I not gone to the doctor, I probably would have gotten on a plane to Chicago on Wednesday so I could see Dave's family, and I shouldn't have ignored it then. So it's just kind of hitting different and making me evaluate, life choices and how I want to live my life going forward and how to prolong this big, beautiful life that we have for as long as I can. So I'm sending you all love, and I just ask for love and support in return, which you guys always do. So, friends, family, and health are the most important things in the world, and I love you guys so much, and I'm gonna get through this, and yeah, we'll talk soon, okay? Love you. Bye.